This is Dr. Lam, founder of Dr.Lam.com, and today we're going to talk about a somewhat common symptom of adrenal fatigue that's seldom understood, and it is the presence of low back pain without a history of any trauma and in the presence of a normal examination. Now, low back pain is such a common phenomenon that a lot of people suffer, but most of the time, if you trace it, there is usually a common root problem. Of course, the most common root problem can be due to a past history of trauma, slip and fall, and in women, it even could be a history of labor pains and epidurals, etc. So usually, if you trace it deep enough, you can find a reason or at least some aggravating factor. In the case of adrenal fatigue, the situation is somewhat different. People would complain of pain that's like a dull ache. Most commonly, it happens in the kidney area, kind of where the adrenal glands are. Now, remember, adrenal glands are the size of like a walnut and is located right on top of the kidney. So if you look at the back, the low back, it is commonly presents itself as like the dull ache. Now, we know that there's no physical nerve that is somatic in nature, meaning that it carries pain signals to our brain from the adrenal glands. So where could the pain be coming from? And because of this lack of physical direct connection, pain in the low back is oftentimes dismissed, and adrenal fatigue and adrenal issues are seldom being considered. This is, I say, interesting because we don't have the ability to explain why, if that is the case, that people do complain of it. Now, we as clinicians dealing with adrenal fatigue every day do see this phenomena. We also don't have a good physical explanation, but we do see it enough times to know that this can exist. And even though we may not have a pure scientific evidence relationship, meaning on gross anatomy and pathological findings, we have a sense that this does happen and it is real. The pain, as I said earlier, is dull in nature. It's always in the adrenal areas, and it does seem to get a little worse with stress. And oftentimes you can feel that also with a little bit more caffeine, and some people will report that. Now, we suspect that this may be due to some form of inflammation or some form of adrenal overload that causes inflammatory response, resulting in swelling, heat, and some form of discomfort. So if you have back pain around the kidney areas and you've seen your doctor and you are told that your kidneys are fine, your urinary tracts are okay, you don't have any bladder, cystitis issues, and everything checks out normal, and you have stress consistent with adrenal fatigue, this is one common symptoms. Now, the good news is that usually this type of pain can resolve as the adrenal gets better, but not all the time. But we have to be very clear and be very sure of what it is, because you don't want to miss anything. So if you do have pain in this area, see your doctor, make sure everything is fine structurally, and if there's nothing really going on that can signal this, then do think of adrenal fatigue as one of the possible symptoms, because we do see it clinically. I hope you've enjoyed this video. For more information on this topic, head over to Dr.Lam.com, where I've written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.